Hi, we're here today with our patient Brenda. Hello, Brenda.
Hi.
Could you tell us what part of your body that we worked on?
My right shoulder and my right hip.
Okay. And what kind of a problem did you have with your right shoulder and your hip?
Well, I had been diagnosed with a torn rotator cuff and had received benefit from physical therapy for a while, and then it started getting tight again and sore and limited movement for my shoulder. Then my hip, I started having hip pain and was diagnosed with a torn labrum and a little bit of arthritis on the top of the joint.
Okay.
So I had a lot of discomfort in both places.
And so you came to us and we did a stem cell procedure on both your shoulder and your hip.
Right. And the reason, if I can tell you, the reason I came to you is because when I went to the doctor about my hip, they pretty much said, take Tylenol and come in and get a cortisone shot every now and then. And that really wasn't appealing to me. So I started doing research on the stem cell replacement therapy. And I found Dr. Grana on the internet and did even some more research as far as who had been doing this type of procedure and for how long they've been doing this type of procedure. So that's why I selected Dr. Grana. And anyway, things are really good right now.
So how did you tolerate the procedure?
Oh, the procedure was tolerable. It was not the part, taking blood, that was no big deal. The taking the fat part, that was no big deal. The aspiration of the hip was no big deal. The injection was no big deal. The little bit of discomfort when the fluid was going into the joint area. And I had a little bit of discomfort the next day. But the day after, the discomfort that I got from the procedure was gone.
Excellent, yes. That's a desired and expected inflammatory response that is expected and desired to promote healing.
Yeah.
So let me ask you, what is the result now? Could you give me some idea, like on percentage of how your hip and your shoulder are doing and what your feelings are about it now?
Well, it's been, I guess, about a month since my booster. And at first, I didn't feel much results in my shoulder for a couple of weeks. And then just one day, it was like, oh, I don't feel pain. The hip was a more gradual response, and it slowly diminished to the point of where I hardly have any hip pain at all.
What percentage would you say that the improvement was for you, Brenda?
Wow. I would say I'm at probably about 95%
Wow.
improvement on my hip and probably about 90% on my shoulder.
That's fabulous.
Yeah.
May I ask your age, please?
I'm 60.
You look fabulous. You look fabulous.
Yeah, thank you.
Well, would you recommend this procedure to people?
Oh, absolutely. I tell everybody about it. Everybody who's got problems with their joints, I tell everybody.
Dr. Grana is doing these procedures using most of the most advanced methods. So we get wonderful results like yours, and I want to thank you for talking with us today.
Thank you.
Bye-bye now.
Bye.